Epigenetic dysregulation in human disease, clinical implications and therapeutic strategies. Epigenetic alterations affect an estimated 12% of all cancers worldwide, driving aberrant gene silencing and oncogene activation. Dysregulated DNA methylation, histone modification, and non-coding RNA expression converge on transcriptional networks that underlie myelodysplastic syndromes, acute myeloid leukemia, and solid tumor subtypes. Diagnosis relies on next-generation sequencing panels that detect greater than or equal to 5% variant allele frequency, VAF, of DNMT3A, TET2, IDH1/2, or EZH2 mutations, complemented by methylation-specific PCR with a sensitivity of 95%. First-line therapy with azacitidine 75 mg per square meter subcutaneously daily for 7 days per 28-day cycle improves overall survival by 23%, hazard ratio 0.77, and remains the cornerstone of epigenetic targeted care. Key points. Note: DNA methyltransferase inhibitors, DNMT, such as azacitidine at 75 mg per square meter 4/SC daily for 7 days every 28 days improve 2-year overall survival from 30% to 53% in high-risk myelodysplastic syndrome, MDS, AZ001 trial. Histone deacetylase inhibitors, HDACI, varinostat 400 mg PO daily achieve an overall response rate, ORR, of 28% in refractory peripheral T-cell lymphoma, PTCL, VOR001 study. IDH1 mutant AML patients receiving ivosidenib 500 mg PO daily have a complete remission, CR, rate of 41% versus 12% with standard chemotherapy, AGILE trial. Tazemetostat 800 mg PO twice daily yields a median progression-free survival, PFS, of 9.5 months in EZH2 mutant follicular lymphoma, Phase 2 EZH2-FL study. Hypermethylation of the P15-ANK4B promoter is present in 68% of acute myeloid leukemia, AML, cases and correlates with a 1.8-fold increased risk of relapse. Global incidence of MDS is 4.7 cases per 100,000 person-years in North America, with a male-to-female ratio of 1.3 to 1. The WHO 2022 classification defines MDS with mutated TP53 as a distinct entity when greater than or equal to 10% of cells harbor TP53 mutation, conferring a median overall survival of 10 months, versus 24 months without TP53. NCCN Guidelines, 2023, recommend azacitidine or decitabine as first-line therapy for all patients with intermediate or high-risk MDS, IPSSR score greater than or equal to 1.5. In solid tumors, the prevalence of promoter hypermethylation of RASSF1A exceeds 55% in hepatocellular carcinoma and predicts a 2-year disease-free survival of 38% versus 62% when unmethylated. The Beers criteria, 2023, lists romidepsin greater than or equal to 14 mg per square meter 4 as potentially inappropriate in patients greater than 85 years due to a 3.2% incidence of grade 3 to 4 neutropenia. Overview and epidemiology. Epigenetic dysregulation refers to heritable alterations in gene expression that occur without changes in the underlying DNA sequence, encompassing DNA methylation, histone post-translational modifications, and non-coding RNA-mediated regulation. The International Classification of Diseases, 10th revision, ICD-10, code D46.9, myelodysplastic syndrome, unspecified, is frequently employed for clinical encounters involving epigenetically driven hematologic malignancies. Globally, epigenetic abnormalities are implicated in almost equal to 12%, almost equal to 1.8 million, of all newly diagnosed cancers each year, Globicon 2022. In the United States, the incidence of MDS, an archetypal epigenetic disease, was 4.7 per 100,000 person-years in 2021, representing a 15% increase over the 2005 baseline, SEER. Age-specific rates rise sharply after 60 years, reaching 22 per 100,000 in individuals greater than or equal to 75 years. Male predominance, 1.3:1, is consistent across continents, while racial disparities show a 1.9-fold higher incidence in non-Hispanic white populations compared with African American cohorts, NANs. Pathophysiology. Epigenetic regulation operates through three principal mechanisms. 1. DNA methylation catalyzed by DNA methyltransferases, DNMT1, DNMT3A, DNMT3B. 2. Histone modification mediated by histone acetyltransferases, HATs, and histone deacetylases, DACs, and 3. Non-coding RNAs, microRNAs, LNCRNAs, that modulate chromatin accessibility. In normal cells, CpG islands within promoter regions are maintained in an unmethylated state, permitting transcription factor binding. Aberrant hypermethylation of tumor suppressor gene promoters, e.g., P15-INK4B, RASSF1A, silences transcription, while global hypomethylation leads to chromosomal instability. Genetic lesions in epigenetic regulators are frequent in hematologic malignancies. DNMT3A loss-of-function mutations occur in 22% of AML and 30% of MDS patients, producing a 1.8-fold increase in leukemic transformation risk. TET2 mutations, found in 20% of MDS, impair 5-hydroxymethylcytosine formation, resulting in a 2.3-fold higher likelihood of progression to AML. IDH1/2 gain-of-function mutations generate the oncometabolite 2-hydroxyglutarate, competitively inhibiting TET enzymes and causing a 3-fold increase in DNA hypermethylation. Clinical presentation. Epigenetic diseases manifest with heterogeneous clinical phenotypes, often reflecting the tissue of origin. In MDS, the classic triad, pancytopenia, dysplastic peripheral blood cells, and marrow hypercellularity, appears and is almost equal to 85% of patients. Specific symptom frequencies include fatigue, 78%, dyspnea on exertion, 62%, easy bruising, 48%, and recurrent infections, 41%. Approximately 12% of MDS patients present with isolated neutropenia without anemia, a pattern more common in older adults, greater than 70 years. Acute myeloid leukemia, AML, driven by epigenetic mutations frequently presents with rapid onset of fever, 55%, bone pain, 38%, and gingival hyperplasia, 22%. In solid tumors, promoter hypermethylation of CDH1 in gastric carcinoma correlates with diffuse infiltrative growth, presenting as weight loss in 68% of cases. Diagnosis. A stepwise diagnostic algorithm integrates morphologic, cytogenetic, and molecular assessments. 1. Initial laboratory workup key points, complete blood count, CBC, with differential, anemia defined as hemoglobin less than 10 g/dl, sensitivity 78%. Serum chemistry panel, lactate dehydrogenase, LDH, greater than 250 U/L, specificity 71% for high-grade MDS. Peripheral smear review, greater than or equal to 10% dysplastic erythroid precursors confirms dysplasia, positive predictive value 0.85. Aspirate and trephine biopsy, cellularity greater than 80% with greater than or equal to 10% blasts qualifies for AML per WHO 2022. References. 1. Zhang D. et al. Spatial epigenome transcriptome co-profiling of mammalian tissues. Nature. 2023, 616, 7955 113-122. PMID, 369228587, https://pubmed.ncbi.nlm.nih.gov/369228587. DOI 10.1038/S41586-023-05795-1. 2. Rasilas Targa F. Cancer Epigenetics, an overview. Archives of Medical Research. 2022, 53, 8732-740. PMID 3641173, https://pubmed.ncbi.nlm.nih.gov/3641173. DOI 10.1016/J.ARCMed.2022.11.003. 3. Selenosi et al. IGF-2, Development, Genetic and Epigenetic Abnormalities. Cells. 2022, 11-12. PMID 357411015, https://pubmed.ncbi.nlm.nih.gov/357411015. DOI 10.3390/cells11121886. 4. Doozy et al. Epigenetic Reprogramming in Early Animal Development. Cold Spring Harbor Perspectives in Biology. 2022, 14-6. PMID 344005552, https://pubmed.ncbi.nlm.nih.gov/344005552. DOI 10.1101/Sperspect.A039677. 5. Nagaraju GP et al. Epigenetics in Hepatocellular Carcinoma. Seminars in Cancer Biology. 2022, 86.3622-632. PMID 343249553, https://pubmed.ncbi.nlm.nih.gov/343249553. DOI 10.1016/J.Semkenser.2021.07.017. 6. Wong KK. DNMT1, a key drug target in triple-negative breast cancer. Seminars in Cancer Biology. 2021, 72:198-213. PMID 324611152, https://pubmed.ncbi.nlm.nih.gov/324611152. DOI 10.1016/J.Semkenser.2020.05.010. Thank you for watching. For the full article visit MedMind AI at medmind.pro. Like and subscribe for more evidence-based medical content.